For as well, but yes, friend of mine too. Oh, okay.
But traveling,
Right.
we wanted to focus on. We're going to talk about you, of course, and but we'd like to focus on cupping, which I don't think is very popular. Not how should I say it? Not it's not. But Chinese medicine is not exceptionally popular, to
Right.
begin with. But a lot
Which
of
I
people
want to start there. I mean, but
Yes,
first,
yes.
before I even start, just
Yes.
kind of tell us your name and your occupation.
Okay. So I'm Tracy Ann Brown. I'm a doctor of acupuncture and Chinese medicine, which means I'm an acupuncturist and a herbalist, and I do cupping and all those things related to traditional Chinese medicine.
Right. So even though Chinese medicine,
You guys, that's why I'm uncomfortable. You want to
Yeah.
hint up on something?
oh sure,
But you want the camera?
yeah,
No, but you need to. With a handle, if you can put the hand, if you want to lean against the handle. You want something probably here. I can put this here because it's so get fancy here with the. Hold on.
yeah.
And all kind of.
Hold on, let me turn this a little bit. Ah, it's still cut off in the head.
Right.
All right, good. Yes. One would think that Jamaicans might be more receptive to the treatments that are offered in the traditional Chinese medicine.
Right.
But you're saying that it's not that popular.
Well,
Give us an idea. Yeah. What when you say not that popular, what do you mean?
Well, relatively speaking, in terms, a lot of Jamaicans do have what seems like an innate trust of herbal medicine broadly. But you know, if you ask most people if they heard of acupuncture, they'll have heard of acupuncture, but they just don't know much about it. That's what I mean. That it's not popular from that perspective, as in people don't necessarily go and seek out acupuncture often.
Right.
But I think if only from karate movies and kung fu movies, people know about acupuncture.
Right.
Right. Less so about cupping, because when you see all those representations in the media, you usually see needles. You don't see cupping so much. Unless you're probably in the athletic world and you see that it's dominant more in sports medicine.
Right.
So people would have seen it there.
So before we get into the specifics of the cupping and the acupuncture and cupping in particular, I want to get just a little bit granular in terms of the medicine itself.
Mm-hmm.
Is there like an empirical basis for you to speak to the efficacy of herbal medicine or Chinese medicine? In other words, do you have evidence by the whatever numbers research that it works?
Yes.
Right. Tell us about that.
So just some background.
Yes.
Chinese medicine is very
thousands
old.
of years. Yes.
3,000 is what they say. Some people go a bit higher, but let's just be conservative and say 3,000 years old.
Right.
So it's been around for a while. It's stood the test of time. As it's in particular as it relates to herbal medicine, the Chinese medicine pharmacopoeia consists of several hundred herbs. So the main herbs number about 200. But there are more than that. There are about 400 or 500 herbs, and these herbal preparations are combinations of herbs. When you study the herbals, you learn the indications, as in what all the things that they're good for.
Right.
You'll study the contraindications, who you should not give it to, what you should not mix it with, what kinds of health concerns you should
and
not
how
be
much you should or shouldn't have.
The dosage is in there, and I don't want to say most importantly, but very important is the research that has been conducted. Now, much of the research into Chinese herbals in particular has been done in Asia and China, but there is research beyond that. So there is a strong body of research. So a lot of times when you look in any pharmacopoeia text, herbal pharmacopoeia text, you'll see references to all of what research they have on the different herbals. And you'll see, it mimics this medication, or a study of a group of so many people that we found this and we found that. So there's a good amount of research on the herbals. The World Health Organization actually endorses the use of acupuncture and Chinese medicine, generally speaking, and they list the conditions that they endorse the use of Chinese medicine for. So that is a strong support of Chinese medicine because it speaks to the longevity of it, the efficacy of it, and the range of the scope of medicine as well.
So
should I even ask about this? But anyway,
I want to.
when did the World Health
organization decide to
endorse it, you know?
Yes.
Why don't we know the year anyway?
I can
It's not
research
recent.
it.
It's not recent. Yeah, because I put out several publications.
Okay.
Because the World Health Organization would put out, releases and press releases and this that on various types of medicine and different types of interventions from time to time. So they put out a few on acupuncture.
Right.
Easily researched.
So, talk to us now about your studies. The path that you took and how you became involved in it.
Boy, my path is interesting.
I'm sure.
Where should I start? Let me start at. Where you want me to start?
You tell me where you'd like to start.
Well, my alma mater is Immaculate. Hi.
It was an alpha. Can we go on?
I know some alpha girls, I know
you
some
know
alpha
that
girls and they're good girls, good women. So, you should be going. I went to UA and graduated from UA with a Bachelor of Science in Computer Science and Mathematics.
Oh, wow.
Yeah. And then went on to study Chinese medicine almost immediately thereafter.
What was the tick that said, okay,
let's go here?
I have a computer degree, but I think I want to do Chinese medicine?
Well, I had always had an interest from a really young age in healthcare.
Right.
And I don't even want to say the healing arts, but just I always thought I needed to have a profession where I was of service and help to humanity.
Right.
And perhaps because my mother is in the healthcare field, that seemed like a reasonable way to go.
Mm-hmm.
And then I developed an interest in Asian culture somewhere in sixth form. So it seemed like a natural merger of interests. And I have many interests, but it just seemed like a natural merger of interests. I didn't know, as much as I loved mathematics all through high school and even into my bachelor's degree, I always had a strong feeling that whatever I graduated with from the University of the West Indies, I was not going to work in that profession.
Right.
But you have to finish with a sensible and decent degree. So I did a computer science and a mathematics degree. But I did love math all along. It's a beautiful science.
Yeah.
Foundation of all sciences.
Right, and you would know that, of course, certainly the Egyptians would have taught maths and healing and those other things as an integrative. Yeah.
Math is a beautiful subject. I can't say it more.
Not compartmentalized.
No,
Yeah.
not at all. I mean, it was not a wasted degree because the studies of Chinese medicine is a graduate program.
Right.
So you did require, well, depending on where you studied, either you do like an associate's degree or a bachelor's degree before, but it's not a first degree. So it's a graduate program.
And you traveled to do this.
And I traveled to the US. I studied in New York initially.
Yeah.
And so it's a 3-year program that I did the Master of Science in Acupuncture. And then I went over to California and did my Master of Science in Oriental Medicine. And the only difference between that is the herbal medicine. Because you add the herbal component to it. And I did those studies in California. That's another year.
Right. What was the general atmosphere in terms of reception? I mean, because I know California tend to be kind of a leader in those types of fields.
Huge Asian population there. So
exactly.
they had the most schools in Chinese medicine in the US.
So you arrived there at I think Pacific you went to?
I went to Pacific.
Right.
No, hold on. I went to Samurai University of Oriental Medicine initially.
Right.
And I did my doctorate at Pacific College of Oriental Medicine. And Pacific College is actually the premier university or college of Chinese medicine in the US. They have several branches across the US, 2 or 3.
I mean, how did all this strike you? You arrived there as a Jamaican. You've done a little bit of work in the field. Now you kind of come to the epicenter of the practice.
Well, let me start with New York. I landed in New York, and New York is New York. New York have everybody in there. So if you feel because you're Jamaican, you can stand out, not happening because like everybody's there. So in my class that started at the same time in September, there's a what do you call him, a Chinese Dominican Republic gentleman. So he's Chinese looking, but he's from Dunrep, or his family is from Dunrep. But I guess probably he moved to the US somewhere in his teen years. There was a practitioner a lady who was born in China, one from Australia.
Wow.
There was a Jamaican 2 years behind me, but he grew up largely in the US, but he's Jamaican. In fact, there were 2 Jamaicans like 2 years behind me. But they, when they moved to the US when they're probably like in their teens. Whereas I moved over there with him as a big woman.
Yes.
Who else? There was a Korean in my class. There was a Turkish gentleman. There were 2 Americans. And they were like, 3 Americans. And it was always
like, they're the minority.
so dry, so boring. So we had Turkey covered, China, Korea,
Latin
Jamaica,
America,
Dom Rep, Australia.
Yeah.
So it didn't feel unusual.
Right.
It just added to the interest and that whole world international vibe of people coming to study this very ancient and old medicine. And it was exciting because one of our main lecturers was actually a Taoist priest, an 88th generation Taoist priest. So he brought all of that. So we talk about traditional Chinese medicine, but then you talk about classical acupuncture,
Right.
which is what I studied, which includes certain classical um, practices, but it also includes what is called traditional Chinese medicine. So when I hit New York, it didn't seem odd. You know what I mean? Being
Yeah.
from Jamaica and studying. I mean, I'm sure people thought to themselves, really?
Yeah.
Interesting. But, we were our own little eclectic
Right.
group.
And neither in California.
And in California, no. The California school was interesting because California, no, that was Samurai University of Oriental Medicine. And it's a much bigger school. And they had three, three sections. So you had the Korean speaking school, you had the Chinese speaking school, and you had the English speaking school.
Wow.
And then, so I was in the English speaking school, obviously. And because the classes were taught in Chinese or taught in Korean. In English. And I actually at the end of my studies there, I was given the award for academic excellence for the English speaking section, which I thought was which I took great pride in.
Of course.
Being a Jamaican coming to study Chinese medicine. But even then, I mean, I think I must have stood out in some ways in that school, perhaps more than in New York. But we're also a diverse batch, and in California, there's such diversity anyway.
Yeah.
So,
So before we get into the actual techniques, one other area, I mean,
you can ask me.
the business, I mean, coming back home, first of all, to establish this practice, what's the rationale behind it?
Well, I never planned to stay overseas. Let's establish that. It was never my
That's what I was hoping to hear.
I never intended to stay overseas. I'd always planned to study and return home. And, I'm going to put it this way, that I come from a very long line of very determined women who, once they make up their mind, they work out how to carve a path or to clear a path. So when I came back, I mean, even when I went off to study, I didn't even know there existed any acupuncturists in Jamaica. Only to discover like a year into my studies that there was at least one. And I said, okay, fine. So I won't be the first. But when I came back, certainly wasn't like every other person was an acupuncturist. So it was really an unusual field.
You know Dr. Louis?
I met him once, but
I think he was one of the first.
I believe he must have been. Yeah, man. He died about a year and a half ago.
Yes.
But I didn't meet him.
Yes.
I heard of him, but I never actually.
Her because I used to go to him.
I know of him, man. Everybody speaks of him,
Yeah.
Yes.
But you see, my mother's a genius. So when I came back, she says, okay, let's just sort this thing out. So she said, we need to have a launch. And she had an official thing. And we made sure we made contact with the Ministry of Health, and we made sure that, so I mean, with everything, networking is important.
Of course.
For people to know about you and know what you're doing, because people are going to always benefit from the service. It's not like it's a medicine that does not work. It works.
Right.
And people, even if only a peripheral knowledge or understanding of acupuncture, they're aware of acupuncture. So I go so far as to say that of what is termed alternative and complementary medicine, the acupuncture is probably one of the most popular ones.
Right.
Even if you don't know the details of it, you know of it. So it's just a matter of giving people information. So I made a point of duty to, we're invited, do radio, do TV, right? And I wrote for the Gleaner for many years in their health segment. So how many years? I don't remember, but for a number of years, I would do regular submissions in their health section. So,
I must have read a few.
Yeah, man. So I capitalize on those kinds of opportunities to really make people aware of what Chinese medicine could offer. And so I would never say I was ever twiddling my thumbs once I moved back to Jamaica. So I've been busy, and the practice has grown over the years. And certainly as people become aware of the benefits of acupuncture, and nothing like the proof, in the pudding.
Sure.
So when people
and a testimonial from somebody who actually benefited.
Exactly. And then of course they went to send their wife or their husband or their children
or
and their friend, because I went and it helped with that, and you have it, and yes, so then you continue. So it's most popular for pain, but even beyond pain, in recent years, Chinese medicine has become well known for fertility or infertility.
Oh,
in conjunction with assisted reproductive techniques such as IVF, IUI. So what you find now that most fertility clinics worldwide usually refer patients to an acupuncturist or have an acupuncturist as part
on
of their
right.
team. And this is
Ah,
coming out of research that supports it, the improved benefit or the increased chances of successful
conception. So, yeah,
pregnancy,
right. Yeah.
right, when you introduce acupuncture in the protocols leading up to the IVF transfer or IUI transfers. And so that's like a mainstay at this point, acupuncture. Most let me see now, most pain clinics in Europe and in Germany um, include the use of acupuncture. So, not uncommon at this point.
Right.
In hospitals in certain countries, in certain Asian countries in particular, stroke clinics, usually acupuncture is done alongside conventional therapy simultaneously. So, the medicine does what the medicine does.
No, and it's best to hear it both from yourself and from
Yeah.
people who have actually, as I said, benefited.
Yeah.
Let's talk now about the cupping
Mhm.
because I'm not that familiar
Cupping.
with that particular treatment, but
Right.
yeah,
So cupping is a suction.
right. I've seen it.
Right. That is created on the skin.
Yes.
So it lifts the skin and the muscles just below it. And it can be done in more than one way. But the main use of cupping is to help to manipulate the musculature of the body,
Right.
where there's spasms, where there's spasms or there's muscular tightness, where there's stiffness. So certain kinds of pain presentations, cupping is indicated for. And it helps manipulate the musculature, it helps to loosen up the muscle fibers, help to relieve discomfort and pain.
Okay.
So a lot of times you're doing cupping on fleshy areas. Lower back pain, you might cup across the back. Mid back pain, pain in the traps, shoulder, some of the fleshier areas. Not so
Right.
much in the bony areas, but it's primarily used for pain management as it relates to muscular issues.
Right.
It also can be used for other types of issues. So some types of respiratory issues, especially the fluids on the chest, cupping is done on the back or on parts of the chest to help to help to relieve that
Yeah.
congestion.
Keep the mucus off, right?
Also, patients who have suffered from Bell's palsy, where there's that deviation of the face, Bell's cupping with smaller cups. I will show you. It's cupping with smaller cups used to help as part of the treatment. So
Oh.
in the olden days, we used to do a very grand affair. You had glass cups and you light
Right.
the fire and you suck out the oxygen.
Yes, that's what that's
and
on the
you got
internet.
quick thing and
That's all
right.
on video.
That's what
Right.
on the video. Yes.
Right, and that's how everybody learns it initially. And you just put the cup down and it stays there, stationary cupping. What I more often do, and which I find better if you have pain in a big area, is sliding cupping. So you slide the cup along the area. Suppose you have pain right across the whole of the lower back and the mid back. Just these one singular cups, which would obviously leave out some areas I don't think is as effective. So you can do sliding cupping, which covers a wider area. You get to manipulate the musculature a little more evenly. You have different types of cups now. You have these silicone cups. So all you do is just squeeze and you press it down and it creates a suction and you slide it up and down. This is for like the bigger areas. For the face, you might use a cup like this.
Yeah.
That would be for the Bell's palsy.
Right.
Yeah.
And for cosmetic acupuncture as well, because part of there's a thing called cosmetic acupuncture
Yeah,
for thin lines on the face, wrinkles, sagging. No, this is not to replace your surgery, because it doesn't give you that kind of dramatic change lift, but it does give you some lift and it does give your face a brighter, fresher look. So you usually do the cupping along with the needles for cosmetic acupuncture. So some cups look like this.
I think people will be very interested in that one.
Oh boy.
But to pick up on that though, that would be a recurring type of treatment situation. So it wouldn't just be a one come to you and you put the thing on the face and boom,
yeah.
That would be a recurring treatment.
There's a series of treatments.
Right.
Usually it's a course of 10 treatments done over the course of 5 weeks. And of course,
it lasts so long.
I've had people say it lasts for a year or a little more. And then you can't do a refresher the following year or in 2 years' time.
So they would need this Botox thing there.
It reduces the need for Botox. Quite frankly, most of the patients who come to me for cosmetic acupuncture do a combination of things. Some of them got Botox in between, and they come and do the facial acupuncture. So they do everything. Yeah, man. They don't want to get not a wrinkle on their face. Not a wrinkle. And but no, so now in sports medicine, cupping is really helpful, especially for athletes who have a lot of muscular injuries and tightness, and So oftentimes, sometimes you'll see athletes like the swimmer Phelps with those big red.
Yeah,
This
right.
way?
Yeah,
Okay.
because I'm losing
So,
yeah, go ahead. Sports
Mr.
medicine.
Phelps,
Yeah.
you'd have seen these big red circles on the back of Phelps.
Back.
Phelps' back.
Yeah.
Just
Not the last Olympics, 2 Olympics back, I think. That's from stationary cupping. But when you do the sliding cupping, you don't see that kind of bruising.
Oh,
It looks worse than it really is because it's not very painful.
Okay.
But it doesn't look like someone trying to beat you and kill you. But
Roughly how long would a particular treatment last? If I come in, say, for a similar issue, back problem, or whatever,
the
what
average
duration would that be?
length of a treatment is 1 hour.
Okay.
It might be a little bit less, it might be more, depending on what you're doing. Because you come in and you get a history, you get information. So as much as a person might say, for example, they're coming for headaches. Oh, I'm here for headaches. It's not that a set of points. These 10 points do headaches. You have to do a certain amount of differential diagnosis and see what else is going on, because you might have headaches because of what we call a liver blood deficiency, or you could have having headaches because of what we call a liver yin deficiency, or because of a chi stagnation. So you have to make that kind of differential diagnosis and see what other types of symptoms are presenting along with the headaches. So, and that's based on the history, based on what's going on in the patient's life, what medications they're taking, and that sort of thing. And then, so you get the kind of information for a few minutes first. Then you put in your needles, which takes about 5 minutes or so. And then the person stays on the table with the needles for anywhere between 20 to 30 minutes, typically. In some cases, it can be longer, particularly if you're doing scalp points or auricular acupuncture primarily. The treatment will be longer. It can be as long as an hour, but usually it's between 20 to 30 minutes. If a patient is very frail and very weak, you go a little longer, a little shorter, sorry. It's more 20 to 15 to 20 minutes. And then after you take out your needles, send people home. Most times they feel a little better after the treatment. In some ways you can say it is, and in some ways you can say it is not a quick fix. In that, for things like pain and certain kinds of issues, most people notice an improvement in their symptoms following an acupuncture session, or within 24 hours following an acupuncture session.
As early as that?
Yeah, man. Yeah. In many cases, you don't necessarily have a full cure. You don't suddenly jump and skip.
But people will say that they feel better.
Say, I feel a little something. Yes. Sometimes it might take a second treatment before your feet notice that change. But oftentimes, after the first, usually, most definitely after the second treatment, you can feel an improvement. And then, of course, depending on how much relief you get after the first session, then we can gauge how many down the road and frequency. But usually, in the onset of treatment, it's a weekly schedule that most people do. And then thereafter, if it's a chronic long-standing issue, then you might move to every other week, and you can make it less frequent as you go along. But most people come to me for chronic issues.
Right.
Yeah.
Which brings me to another. For non-communicables like, say, diabetes or that kind of stuff, does either of these treatments or any of the other Chinese herbal
help with that?
Help with that?
Yes, ma'am. So now things like diabetes and hypertension, the treatment would involve not just acupuncture, but acupuncture alongside herbals, Chinese herbals. Because now we have conditions that have, had some time to manifest themselves and take hold in your body. So we have to kind of combine a number of strategies to help to manage that. And the biggest thing that defeats most people is their lifestyle choices.
Yeah.
So it's what you're eating.
Yeah.
It's the lack of exercise.
Yeah.
And even and even beyond that, the consistency in treatment. So in other words, if you're taking medication, are you taking it consistently? If you're doing acupuncture, are you doing it consistently? Are you doing the herbals consistently? Many treatments will help. Many types of treatments can help people to manage, but the consistency is always important. And so acupuncture, along with Chinese herbs, helps to manage blood pressure or to reduce the blood pressure and manage it. Also diabetes, so blood sugar. But there's a reason why they call it formative years. Yeah. We've had, in our formative early years, we got into certain habits, and they are hard to break. We love our sugar. Sugar is a wonderful tasting thing.
It's nice.
Yeah. Exercise is tiring and boring. But,
not all of it. Not all of it, but some.
So, but we don't do those things. And exercise is one of the single greatest things you can do to manage your blood pressure, especially when you're in that borderline phase of your blood pressure.
So on that point, okay, some people I see running and doing all kinds of, but to me that seems just like a bit too high impact. what would be the benefits for somebody who's already on a regime with you of regular walking? So let's say even also on an incline.
Mhm.
Is that a good form of exercise
Of
for
course.
folks?
Yeah, man. Anything that, if you're pushing yourself beyond a gentle,
Right. Stroll.
wafting stroll, and you break a sweat, that's goodness exercise. And that will have a tremendous impact on managing your blood pressure and your blood sugar.
Yeah.
Of course, if you're several years into this diagnosis now, it's a little bit more difficult to manage.
Of course.
But it can help.
Yeah.
And on that note, you'll have a number of patients, and I have a number of patients that are on medication already. And
That's what I was about to ask.
Right,
Suppose they're going to them regular MD.
but their condition is not well managed.
Right.
Meaning that they still have spikes.
There are flare-ups.
And they're flaring up. And some days it's good and some days it's not good. And so, well, I'm not know, you have two types of patients. You have some people who are on the medication and it's fine, but they want to go on the medication. But you also have some people who are on the medication and it's just not well managed.
Yes.
So one of the good things about Chinese medicine is that it's often able to be combined with other types of therapies, including conventional medicine. And the main concern you'd have with a diabetic patient, though, when you introduce herbals, is whether you drop the blood sugar too quickly or too low.
Oh.
But then the good thing is that patients are supposed to be testing regularly, so you can monitor that kind of thing and track it, so you can prevent that sudden and drastic drop in your blood sugar, which can cause other problems.
Yeah. Yeah, I mean, my wife is a diabetic, type 2, and the pharmaceuticals just really make her feel lousy.
Yeah. And the thing is, and then of course, so then now, with a patient like that, you want to have a conversation in conjunction with a GP. Right. Because then you want to look at how to gradually reduce the medication. Because sometimes, they're different. You have to consider that they're different end games.
Yeah.
You could have a situation where you're trying to come off the medication entirely. And that is possible. But you have to always be monitoring to make sure that, you're in the ranges that you want. And it's a gradual process. You don't just stop the medication and go take some herbs. You have to gradually...
Yes.
No, because you could create problems for yourself.
Yeah.
Right. Especially if you're at the point where you're diagnosed and on medication, you want to do these things gradually, taper off and increase other interventions. But
okay,
what was the main point I was going to make? Right, we mentioned about when people are diabetic persons who are on herbals or other treatments other than medication, and you can drop the blood sugar too much. And also that it's always good to be checking your blood sugar so you can see where things are as you taper. And then sometimes you might have a situation where you're tapering, you're reducing your medication, increasing the herbal intervention or acupuncture intervention. And you may drop the conventional medication. You may not be able to come off it, but you're able to reduce it.
Right.
And thus reduce some
and
side effects.
are not as bad.
Right. Yes. But then you're adding another therapy, which allows you to take the lowest dose of your herbal of the
conventional
pharmaceuticals.
Right.
So there are these kinds of balances and these kinds of adjustments that can be made. And of course, it just requires some,
consultation.
A consultation, but also that kind of approach of, okay, we're trying this for this period of time, we're adjusting it in this way, all parties are aware of what it is.
Right.
Nobody's going off and doing something different and stopping a medication.
Right. And the patient kind of has to be patient.
Right. And
then the doctor that she's dealing with now, how they personality wise, I don't know how to explain it.
Mm-hmm.
No, if the physician may have a aversion to non-conventional
like say, all right, if you want to do that, or you know, or you can work together.
Because I've known doctors here who have that kind of stance. That non-traditional therapies are not
they don't
valid.
want to, because of
more and more medicine is evolving where there's an understanding that no one way necessarily cures everything. Mm-hmm. So if a person is not aware of or understanding, they don't understand a therapy, they can't advocate for it. In other words, if you don't know what acupuncture is or how it works, they can't sit here go and do acupuncture.
Right.
If they don't know this particular herb does that, they can't advocate for it.
But they
may say, well, try it.
Yeah.
And if it and they'll have some there's some doctors who will have the conversation with you, and they'll say, well, you can try this for this period of time, and we can have a dialogue. Nowadays, I find just generally healthcare practitioners are more willing to have these conversations with their patients,
or at least check this out.
And nowadays, you never use a doctor's cell phone number. You can reach your doctor sometimes and say, listen, I'm trying this or thinking of this. And they will answer you, I mean, yes, they're under pressure sometimes, but conversations can be had.
Sure, sure.
And times are not what they used to be.
Yeah.
I certainly have a number of, doctors in various areas of specialty that will refer patients to me, that will call to find out if it's something that I can treat and address. I refer my patients to some patients to other doctors as well. So sometimes a patient will come to me and I think they require, like for example, to have some blood works done, and so I will refer them to a general practitioner. So there's that back and forth thing, so I get referrals, I give referrals,
Yeah, so there's none of this, well, not much of this attitude of so and so is not a real doctor or whatever.
I haven't had that experience, but
Yeah. Okay, good.
What about cancer?
So there are Chinese herbs that are used to shrink tumors, and then there are acupuncture treatments that are used to help that have been found to be helpful in the management of the side effects of some of the conventional treatments of cancer. And I say it that way deliberately because cancer, you really don't want to play with it.
No, that's right.
And so my position with cancer and certain kinds of conditions is that we are in 2024. There's no reason for you to limit yourself to the type of medicine that you're going to seek out because you could die. You could die. So you may have, and of course timing is everything here now. So you might do surgery, you might need to do chemo. During chemo, they don't want you to do certain kinds of other therapies along with the chemo because they don't know what the interactions are. And the interactions is what the issue is. It's not so much that you can't do the herbal disease interaction of the chemo that you're doing. So you can always, before you start chemo, do the herbals to reduce the tumor. Then you take on the chemo and you get your time things. You work out the schedule of your treatment for conventional medicine and work out how to then insert other types of therapies. And then, of course, you have some patients, they're decided to do the chemo, fine. And then, of course, suppose the tumor shrinks a bit, but it's not completely gone. And you have different stages of treatments. And so you could always introduce herbs after the chemo is done, or in some cases, because radiation is not necessarily always done. An oncologist will give different types of treatments depending on what is presenting and how it's presenting. And of course, with the strength of a patient comes into play as well.
Okay.
So, and you do some medication treatments, and some people have nausea, they'll have peripheral neuropathy, so they'll have this really icky feeling on their feet. Icky is my word, but it's like numbness.
Perfectly understood.
That numbness, tingling, feeling like you're not feeling the sensations correctly in your feet.
You don't feel grounded.
Which is a really disconcerting feeling.
Sure.
From what I can understand, and that can come about post chemotherapy or while you're on chemotherapy, nausea, fatigue, other types of symptoms, and then acupuncture shines because it helps with that as well. Cancer in and of itself can cause pain.
Of course.
And so there are auricular, and by auricular I mean air acupuncture points that are used to help to manage pain, generally speaking, from cancer. So Chinese medicine can be used for different treatments as it relates to cancer, both from at the front end from reducing the tumor, but also where it comes to pain management of the symptoms that present with the cancer, so things like pain, and also it can help with the management of symptoms that